Good afternoon, everyone. Thanks for joining us. I'll start today with an update on our COVID-19 numbers. As of today, we have had 1,028,131 cases, 1,434 new cases reported since yesterday, 694 people in the hospital, and sadly, 13,550 people who've died. Fueled by the Delta variant, we've seen a recent increase in cases, percent positives, and hospitalizations. We pray for those who are sick, the people we've lost, and the ones that they've left behind. The best way to combat this pandemic is with vaccines. And in positive news, we've hit a new milestone today. 60% of North Carolina adults 18 and over have received at least one dose of the vaccine. That's good. This summer, it's been uplifting to see so many people getting back to the things they love to do, hugging their grandkids, taking vacations, gathering with friends, going to sporting events, visiting their favorite local shops in person. Vaccinations are making this possible. While this disease is still with us, the more people get vaccinated, the less it has to affect our day-to-day lives. Thanks to safe and effective vaccines that are free and everywhere, North Carolina has entered a new phase of this pandemic. This new phase is marked by a laser focus on getting as many people vaccinated as possible. It will literally save their lives. The vast majority of the new cases and hospitalizations are among those who have not been vaccinated. It's clear that these vaccines work, and they're our best weapon to fight COVID-19 and the variants. For our part, the state of North Carolina, in partnership with healthcare providers, community groups, and faith organizations, will keep pulling out all the stops to get more people vaccinated. I've been able to visit vaccine sites all across our state, and I'm grateful for the staff and volunteers who are making it easy to get vaccinated. In some places, you don't even have to get out of your car to get a shot. As we enter this new phase, the current executive order will expire at the end of the month. Although we will no longer have a statewide mask mandate, we expect people to be smart, follow public health guidance, and do what works. And today we are releasing strong protocols for schools as they plan for the year ahead. Local school districts should continue to protect students and staff by requiring masks and testing as outlined in the guidance that Dr. Mandy Cohen will be explaining in a minute. The most important work our state will do next month is getting all of our children back into classrooms safely for in-person learning. That's the best way for them to learn. And we want their school days to be as close to normal as possible, especially after the year of disruption they just had. But many students can't get their shots because children under 12 can't be vaccinated yet. We all need to work together to keep our younger children in the classroom and safe. One way to protect them is to get vaccinated yourself. If you're eligible and you get your first shot today, you can be fully protected by the start of the school year and less likely to infect your child. We also know from extensive research that the spread of COVID-19 in schools last year was low because students and staff wore masks. The guidance in the toolkit strongly states that schools should require masks indoors for everyone, students and teachers, in kindergarten through 8th grade. It also directs schools to ensure unvaccinated high school students and teachers wear masks indoors. Studies have shown that masks can slow the spread of this virus among those who are unvaccinated. That hasn't changed. We know masks work. The health and safety and ability of our students to learn in person depends on school leaders following this guidance. Unfortunately, we've seen our statewide numbers on cases and hospitalizations on the rise over the last 3 weeks. This pandemic is not behind us yet. We will continue listening to experts as we share health recommendations and the tools that people need to stay safe. And if the pandemic worsens and additional action is necessary, we'll take it. The best way to stop this disease from spreading and keeping our numbers down is to get more people vaccinated. And we have made so much progress against this virus, and now is not the time to ignore it. Even if you have been vaccinated, take it upon yourself to encourage others to get a shot. I'm confident that we can clear whatever hurdles remain and emerge from this pandemic stronger than before. Now I'd like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to provide more information about the public health direction being given to our schools. Dr. Cohen.
Thank you, Governor. As we head into a new school year, our North Star remains keeping students in classrooms. We have learned so much about how to keep our kids learning in person and doing it safely. Today, we're releasing an updated Strong Schools Public Health Toolkit aligned with both CDC and the American Academy of Pediatrics guidance, both which urge that everything possible be done to keep students in the classroom. They emphasize that with proper safety prevention measures, the benefits of in-person school outweigh the risks in almost all circumstances. The best COVID protection measure we have is vaccination. Vaccines provide protection from serious illness, COVID-19 related hospitalizations and death, as well as complications from the virus. Rigorous clinical trials among thousands of people ages 12 and older have proven that vaccines are safe and effective, and more than 160 million Americans have been safely vaccinated. However, with only 24% of North Carolinians ages 12 to 17 fully vaccinated, and because anyone under the age of 12 cannot be vaccinated yet, we still have a long way to go. Schools need to use the additional safety protocols outlined in the Strong Schools NC Public Health Toolkit to continue to protect students and staff as we enter the new school year. As the governor said, the toolkit says all schools for kindergarten through 8th grade should require all children and staff to wear masks indoors, regardless of vaccination status. For schools in 9th through 12th grades, schools should ensure that anyone who isn't fully vaccinated, including students, wear a mask indoors. We've also updated quarantine guidance so that we can keep students in school whenever possible, particularly when proper prevention measures like vaccines and masks are used. Anyone who is fully vaccinated and does not have symptoms does not have to quarantine after a close contact with someone who has COVID-19. In addition, unvaccinated students do not have to quarantine after close contact if students were appropriately and consistently wearing masks. The toolkit includes additional measures for schools related to physical distancing, which we've reduced to 3 feet whenever possible. Testing, which is being provided free to schools for students and staff with symptoms, as well as testing for screening. Transportation guidance, cleaning, and other considerations are in the toolkit. Importantly, we also took out a number of protocols we now know through scientific research that don't have benefit so that schools can really focus on the things that work. The updated toolkit reflects the expertise of the CDC, the American Academy of Pediatrics, and our public health experts on how to keep our kids in person and safe in schools with layered prevention strategies. It is important to note that the need for additional statewide action and changes to the toolkit may be needed over time as we receive new data, watch our COVID trends, and hopefully see vaccinations become available for children under the age of 12 later this year. School leaders should continue to consult with local public health officials for input to make local decisions. Now, as a mom of 2 elementary age students who are too young to be vaccinated and also attend the Wake County Public Schools, I know how hard our educators and school staff have been working. I want to thank North Carolina superintendents, their educators, and school staff who have worked tirelessly throughout the pandemic to keep children safe and learning. One way we can all show our thanks is doing everything we can to end this pandemic. That means get vaccinated right now if you haven't. We are seeing the impact of the very contagious Delta variant COVID-19, and it's hitting those who are unvaccinated very hard. Cases are up, hospitalizations are up, the percent of tests that are positive are up, and we know that even people who have a mild case of COVID-19 may struggle with long-term effects like shortness of breath or chest pain and brain fog. Now, this moment is different than the last time we experienced rising trends. Now, vaccines are widely available across the state, and 60% of North Carolina adults have received at least one dose. We also know 94% of the cases and hospitalizations we have now are in people who are not vaccinated. The Delta variant is formidable, but vaccines are the best way to protect your health. If you've already received a vaccine, talk to your friends and family about why you chose to get vaccinated and share your experience. Don't wait to vaccinate. Go to myspot.nc.gov to find a vaccine location near you. Thank you, Governor.
Thanks, Dr. Cohen. Appreciate all the hard work and collaboration that you've had with our schools, with our superintendents across the state, with the State Board of Education. Grateful for that. Getting our kids back in the classroom full-time, in person for instruction is critical. And this health guidance will help schools do it safely. Thanks to these safe and effective vaccines, we can make sure the darkest days of this pandemic are behind us. Now, to turn the final corner of this disease, we need everybody to get a shot. It could save your life and the life of somebody you love. Also with me today is Director of Emergency Management, Will Ray. Lee Williamson is our sign language interpreter. And behind the scenes, Jackie and Yasmin Mativier are our Spanish language interpreters. We will now take questions from the media in the room. If you guys could go to the microphones over there. We'll also probably hit the video for some questions from people who aren't with us today.
Governor Cooper, if you're requiring K through 8 to still wear masks, some districts have already indicated that they're not going to follow that mandate. There's just been conjecture. Some have gone to vote. What, in terms of enforcement or any other steps, are you going to take to make sure the mandate is being followed?
So at the end of this month, the statewide mask mandate will expire. This cool toolkit, we want to help the local school districts to implement this, and we want them to require these masks as per the toolkit. We want to give them the flexibility they need, but also give them all the help that they need to implement this.
What if they don't implement it?
Well, there's going to be a big push all across the state from our office and from others to try to make sure that this is in place, because we know how important it is to make sure that these children are protected and that teachers are protected.
But we know that sometimes things aren't followed from maybe given another situation where there's a state guidance or a state mandate in a school district that is funded by the state doesn't follow it. Will there be repercussions? I guess I'm asking from an enforcement standpoint, how will we see that play out if a school does not follow this guidance?
You know, that's been an issue from day one. We all know what to do. We need to all pull together and make sure we try to get it done.
Thank you.
Yes.
Matt Mercer, North State Journal. A couple questions for you. First of all, the prevalence of the Delta variant has been steadily growing over the last couple months. Are you seeing anything, or do you know if that's coming from the number of border crossings and those individuals being bused or flown into North Carolina?
I don't have any information that that is the case, no.
Okay, so follow up on that. Another issue for this upcoming school year that's been in the news a lot is critical race theory and the components of that, you know, being used for teacher trainings or being used in the classroom. What is your position? Do you think that those components should be used in schools?
What I think is we need a good teacher in every classroom and a good principal in every school, and we need to keep them safe from COVID-19. That's what I'm focused on right now.
So I take that to mean that you'll also sign the
Next
bill
question.
from Senator Berger's office, and assuming that passes the General Assembly?
We hadn't seen that legislation come from the General Assembly yet. Yes.
Thanks, Governor. I had two questions on two separate topics for you. We've seen LA County is mandating masks even for unvaccinated people, and the fear is Delta variant surge. Why is now the time to end the statewide mask mandate rather than bring it back in some way, even for those who are vaccinated?
Well, California does not have a statewide mask mandate. I've talked to a lot of governors across the country, and most states do not have statewide mask mandates. There is, however, strong guidance from the CDC and from the Secretary of Health and Human Services to say that we all should wear masks in certain places, like healthcare facilities, like on public transportation. We fully expect those entities to require, they're in the best position to require it and enforce it. And we are expecting those entities to do that as we expect these schools to do it. We want to do this in the most effective way, and we are entering a new phase of this pandemic. I mean, we've gotten a lot of people vaccinated. Everybody can get one. We need to all work together to make sure this is responsible.
I should say Brian Anderson with the AP, by the way, for
For
that.
I got that.
In 2018, you appointed, forgive me if I'm mispronouncing it, it's either Stephen or Stefan Futrell to the Superior Court in District 16A. And we recently reported on a case of him moving to jail an editor after one of his reporters brought in a recorder into the courtroom. I'm curious if you plan on reporting that to the Judicial Standards Commission. We asked your office a couple weeks ago, and we're still looking for a comment from you.
So I don't know the situation involving that. I know that our courts should be as open as possible, but I do know that the court has certain rules that it can implement. I'm not familiar with all the facts of that case.
Would you encourage courtrooms to be more open and even allowing recording devices, so this isn't even a conversation?
That's something I think we would have to discuss with members of the bar and with judges and others. Yes.
Andrea Blanford with ABC 11. I have a question about breakthrough cases. We are seeing more reports of breakthrough cases across the country. Anecdotally, do we know how many we are seeing here in North Carolina? And in light of breakthrough cases, how would you reassure folks, perhaps even people who contracted COVID-19 in the past, that they should still get vaccinated?
We are seeing more breakthrough cases. In North Carolina since May, about 6% of our cases have been breakthrough cases. The good news is that this illustrates even more that vaccines are working, because almost across the board, the people who become infected who are vaccinated are less seriously ill, and there's less of a chance for them going into the hospital and dying. So we know, though, that this Delta variant is extremely contagious, much more contagious than the original COVID-19. So that is, I think, contributing to the fact that there are more breakthrough cases that we are seeing. But that's even more reason for people to get vaccinated. Would you want to add something, Dr. Cohen? Okay.
And in light of the folks who contracted COVID in the past who think that they have enough immunity even against the Delta variant, would you have a message for them?
Oh, they need to get vaccinated. It's not enough protection to just simply have had COVID. You need to get vaccinated.
I have one more question for you. Just also in light of the uptick in cases that we're seeing, we have some large gatherings that are still taking place coming up tomorrow. For instance, Raleigh's State of the City, County, and Schools. There will be several elected officials in attendance, the Raleigh mayor. What would your guidance be, and what do you anticipate changing perhaps in the way of mandates in regards to large indoor gatherings?
It is so important for unvaccinated people to wear a mask. That's the number one thing. Dr. Cohen, I'll let you address.
So as always, we have guidance for our state, and today's toolkit is very clear about what we think our schools should be doing. But I would always say that we expect that districts, whether it's cities or counties, really work with their local public health officials to make sure that they are tailoring guidance to what they are seeing in their communities. And so the city of Raleigh or Wake County may want to take the step to make recommendations about mask wearing indoors. I've said that, as the governor said, unvaccinated folks should continue to wear a mask. But there's also no reason that folks who are vaccinated shouldn't feel like they couldn't wear a mask. Absolutely wear a mask if that's something that you feel will be additional protection for you. And so we look forward to assisting counties or municipalities in decision making as they go forward.
Thank you.
Thank you.
I apologize for the frog in my throat. Yes.
I've got a couple of questions on the order and then the toolkit also. So with the executive order expiring, does that mean the state of emergency is ending at the end of the month also?
No.
How long is a new order going to be in place to extend that, or are there restrictions tied to it also?
The executive order is extended a little while longer in any event. And I'll tell you this, I mean, we've just had today our highest number of cases and hospitalizations in about 2 months. We are working with the General Assembly. You know, there are a number of things that we're able to do, particularly in getting people vaccinated, that we are able to do because we're in a state of emergency. And there would be some statutory changes that the legislature could make that would allow us to do those things without a state of emergency. So we're going to continue talking with them about how to do it, but right now the state of emergency will stay in place, and you know we'll end it. We want to end it as soon as we can, but right now it needs to stay in place for the health and safety of North Carolinians.
Are there any related mandates? So when the mask mandate in schools is lifted, does that go for public transit and prisons and everything else, and that's up to those particular agencies or localities?
Yes.
And then real quick for Dr. Cohen, with the new toolkit, the recommendation is through K-8. Is that because of just how 12 and up is like half a middle school maybe, or some of a middle school? Is that the reasoning there?
Yeah, thanks for that. Yes, we say that schools should require masks for K through 8th because we know already that anyone under the age of 12 can't get vaccinated. And so in a middle school situation, you have a mix of kids who are eligible and who aren't. And there's been pretty good research that has been done around not just making sure that we are protecting those who have no eligibility for vaccination, but also around bullying in a school. And so we actually think it's important for us to include middle school in this universal mask requirement. We do feel differently for high school, where all high school students and their teachers are eligible for vaccines. And we want to show that when you do get vaccinated, that you are able to take off your mask. And we hope that will be an additional incentive for our high schoolers to go get vaccinated. As you heard, only about 24% of those ages 12 to 17 are currently vaccinated. That's way too low, right? So that means 75% of most high schools, if not more, are going to be completely unvaccinated. So got to get vaccines, number one, absolute prevention, and if not, making sure that folks are wearing masks. Thanks.
Thanks.
Yes.
Dr. Cohen should just go back to
Okay.
because Rose Hoban from NC Health News with a couple of sort of public health type of questions. So the Surgeon General, Vivek Murthy, put out I guess it's a directive or a statement this past week about misinformation being a public health problem. So, you know, what is your department doing to combat this misinformation? I mean, I know, you know, political campaigns, they're able to manipulate, you know, Facebook, SEO, things online. Like, what kinds of campaigns are you running? You know, things that you're doing, information campaigns, and how are you targeting folks who you think might not be getting vaccinated?
Rose, this is a really important topic about misinformation because unfortunately there is a fair amount out there, and I really want to encourage folks to make sure you are getting trusted and accurate information. I do want to thank the folks who are our amplifiers, you all here, the press corps and others who share information. And, you know, actually we had a situation yesterday where a mistake was made related to some data, and actually was not that was an unfortunate mistake, and it's already been corrected, but this just shows how quickly misinformation can spread and why it's really important for folks to be getting that accurate information from trusted sources. So from DHHS, from the CDC, from trusted academic sources. And so we are always going to continue to make sure we're promoted things. Obviously, it's the federal government that has much of the responsibility here for these major technology platforms and such, and I applaud them for making sure that they are helping direct folks to good information and taking down bad information.
And then I have a follow-up. We haven't been one of the kind of states that's done lots and lots of genomic testing. How much genomic testing are we doing right now? We're seeing right now that 60%, according to the CDC, 60% of what's circulating in the U.S. is Delta. Where are we as a state? Do you know?
Yeah, we're actually doing quite a sizable amount of genomic testing. We just got updated information last night from the CDC that similar to what we're seeing across the country, about 80% of the cases that we are sequencing here are the Delta variant. So what we are saying, more likely than not, if you are getting a case now, it is likely the Delta variant. Delta has now basically swamped all of the other types of COVID at this point. So we are doing that a fairly sizable amount of genomic sequencing, both in coordination with the CDC, our own state lab, as well as some of our larger lab partners here in the state. And what I would say is COVID is here. It is spreading quickly. It is more than 80% of our cases.
Can I have one quick follow-up with the governor? The Senate bill, I think it's Senate Bill 173, the Free the Smiles Act, would restrict school districts' ability to mandate masks in schools. It's in conference right now. What are your plans to sign it or not?
Well, I think that's a bad idea, and it's pretty obvious from this toolkit that we're rolling out today that we want local school districts to require masks in K through 8 and for unvaccinated in 9 through 12 in order to protect educators and students there. Yes.
Hi, it's Jason DeBruin with North Carolina Public Radio. Really just one question around booster shots, especially as Delta is taking over, as you say. People who are vaccinated are starting to become concerned that even with their 2 shots and being fully vaccinated, that they could be at risk. What sort of guidance have you given, or how are you thinking about recommending booster shots down the road at some point?
Dr. Cohen.
Thanks, Jason. It's something we're following incredibly closely, and this will often be governed by our federal partners at the CDC and the FDA. The CDC Advisory Committee on Vaccines, in fact, is meeting today to discuss this topic specifically related to those who are immunocompromised, and are they going to need a booster? And I think we're using booster as a catch-all term for, is there going to be a third dose given, or is it going to be something else? So I think we're still teasing through that data along with our federal partners. And I think what we're saying still is that these vaccines continue to be incredibly effective. And that's what you see with 94% of the cases are in the unvaccinated, but breakthrough cases happen. And that's why we've said before, for those who know that they are at higher risk, either because they're immunocompromised, they're over 65, they have chronic diseases, put on a mask, extra layer of protection right now. You don't have to wait for a booster. So wearing a mask indoors, particularly when you're around other people, again, an additional layer of protection there. And then we'll continue to watch the science and the data and work with our federal partners. Thank you.
Hi, Michael Hyland from CBS 17. I want to ask you first about something you said at the beginning. You said if the pandemic worsens and additional action is necessary, we'll take it. What does that mean? Are you considering reinstating restrictions already? What would it take to trigger that?
Well, I just want people to know that we are ready to do whatever is necessary to protect the health and safety of people. We are concerned with the increase that we have seen in our numbers, our hospitalizations, and people just need to know that all of the options continue to be on the table. Today, however, we are very focused on trying to make sure we get our children back in school in person as normal as possible, try to avoid outbreaks in schools, and that's what this toolkit's about.
Are there any steps you want communities that have lower vaccination rates, local leaders, to be taking now in terms of requiring masks or anything like that?
Well, I'd rather them focus on vaccinations. That is where, as we enter this new phase of the pandemic, we know what works. We know vaccinations are the key out of this. Vaccinations are better than all of the other prevention efforts that we can take. And I would request and plead with community leaders to step up, tell people, look, I've been vaccinated. I know it's safe. We need you to get vaccinated. And, you know, we have seen counties in North Carolina with lower vaccination rates have higher outbreaks, particularly with this Delta variant here. So we're in a race, really, with COVID-19 and the Delta variant, and we want to win that race, and we can win it by getting people vaccinated.
In the toolkit, you all cited both the recent CDC guidance and the American Academy of Pediatrics in there. Why did you all come down on the side of recommending that kids who are fully vaccinated don't need to wear masks?
Dr. Cohen.
Thanks, Michael. I think we are very much aligned with the American Academy of Pediatrics, which recommends universal masking. We said that for K through 8, we want to see universal masking regardless of vaccine status. For our high schoolers, we did treat that slightly differently, where we said, you know, if you are vaccinated, we want to make sure that they have the benefit of the fact that is protection. And so we did make a distinction there just for our high school students. But I would also say, and you can see when you read the details of the toolkit, there are going to be reasons why certain school districts are going to require universal masking in high school as well. We are very supportive of folks going even further. I think we wanted to provide that sort of baseline of guidance, but there are multiple reasons, including make it being challenging for some schools to know who is vaccinated and who isn't. So high schools may decide, you know what, we have to do universal masking. Again, I told you how low the vaccination rate is in our 12 to 17-year-olds. Only 1 in 4 are all vaccinated right now. So a school may decide, you know, look, our vaccination rate is too low. We're going to do universal masking until we can see vaccination rates come up. So there's a lot of flexibility in there to go beyond, and there's a lot of reasons why schools may decide to do that. Thank you.
And just one last question I wanted to ask was, while you were speaking, Governor, the NCAE put out a statement criticizing the decision you all have made. They called it poorly timed in light of the rising cases and the Delta variant. I just want to get your response to that.
I'm sorry, who?
The NCAE, the North Carolina Association of Educators.
NCAE.
Oh, okay. Look, we have, I think, the protocols in place to protect students and teachers. We put teachers very early in the process in vaccinations to make sure that they are protected. Would urge all teachers to make sure they are vaccinated before the school year. We think this plan is strong, and we look forward to working with school districts across the state. And before we start doing second rounds in person, do we have any call-ins? Let's take a couple of those first.
Our first question is from Alexis Bell with Spectrum News.
Hey, it's Alexis. Can you hear me?
Yes.
We just saw yesterday how there were a lot of parents at the Board of Education protesting that they shouldn't have to be able to wear a mask, or their kids shouldn't have to wear a mask as a violation of their rights or whatever it may be. What is the message to them, and is that the case with these suggestions you all are putting in the school toolkit?
You know, masks can save lives, and particularly in children who cannot get a vaccination yet because they are under 12 years old. So it's important for these school districts to take this step to protect children. And we want to keep our children in person in school. And these protocols can be put in place to help be able to keep children in school, which is critical. These masks can prevent an outbreak in a school that would cause the school system to have to make a decision to send children home, and we really don't want to do that. Next question.
Our final question for today's press conference will be from Kimberly King with WLOS.
Mandy Cohen's office for letting me ask a question. I'd just like to take a look at the numbers that you have laid out today. With 1 in 4 children 12 to 17 fully vaxxed, and the vast majority of patients who are coming down with COVID not vaccinated, can you lay out for the public at what point potentially would you put an executive order out, if at all, during the school year, if you begin to see COVID cases climbing for school-age children?
Well, first, we want schools to implement this toolkit that we have put forward today, and we're going to work with them to make sure that they get it done. All options remain on the table. We know that this pandemic is serious, and we're going to continue to keep those options available to us. Would you want to add anything, Dr. Cohen? Okay. I'll take, since you've been so patiently standing there, I'll see. Sure.
Okay, so I'm not trying to harp on this, but it looks like the onus is going to be put on the school board to enforce the mask wearing, right? Is that correct? Okay, and I think the fact of the matter is we're getting close to schools starting, and maybe things were different last year because we were learning via Zoom and all those other things. There was a protest yesterday in Wake County about parents not wanting some of their kids to wear masks in school. We're seeing districts. I'm trying to ask, I mean, in terms of enforcement, that must have been a discussion. So would there be an issue? Are you going to look at funding channels? Why are there going to be any,
Sure. I appreciate the question. And, I want to start with the fact that, and I will say this, as a Wake County parent, I've been appreciative that the schools have worked really hard to keep our kids safe. And I know that our teachers and our superintendents, they want our kids to be safe in school and they want to be in person. And they have done incredible work to implement these protocols over time. With this toolkit, what we're trying to do is focus in on what are the things that really we know work with scientific research. We were doing a lot of things last year, and I think we were learning as we go. I want to thank folks like the ABC Collaborative who did a lot of work to help us hone in on what are the things that really prevent the spread of COVID in a school setting. And what it comes down to, honestly, is masks and a few other protocols. And so that is really what our guidance is here for our schools. And so, yes, we're going to work with individual school districts and schools to say, take this, but we're trying to be really clear to say, you should do this. You should implement these protocols. We'll help you. We'll give you free testing. Whatever you need in terms of support, we want you to do that. But as I said, schools want their kids to be in person. They want them to be safe. And so we look forward to working with them to implement this toolkit.
Don't implement it.
Well, I think that's going to, as the governor said, if we see that our trends are going in the wrong direction, if we see that school districts aren't keeping our kids safe and there can't be in-person learning, there we might have to revisit. But I think where we are in this pandemic is different than when we entered school a year ago. We have vaccines now to protect our teachers, to protect those who are over the age of 12, and we know what protocols work. So I think with that knowledge together, we're entering this school year in a different place, and that's great news. We just have to keep working together to keep each other safe. We'll keep working with our school district to do this, and if we have to do something different in the future, as the governor said, we will keep those options on the table. Thanks.
Okay, guys, I got to cut it off. Thanks. I got to meet.
It's a one-word answer. I've heard you saying we're turning the final corner, but I've also heard a concern about hospitalizations. As a sports fan, if we're in a baseball game, I'm just curious, what inning are we in?
What inning are we in, Dr. Cohen? Those analogies, we'd have to sit down and study that issue.
We're not done yet.
Thank you, guys. Appreciate it.